having a beautiful smile is always in style, and you want a healthy smile too, right?
Absolutely. Joining us now in studio is Dr. Charles Town with Stonehaven Dental. Dr. Town, thanks for being here.
Thank you guys for having me.
You're all about comprehensive care. Tell us what your operation entails.
Yeah, so at Stonehaven Dental, what we do is we focus on the whole patient, like everything that they need. So they may come in with a toothache, but they also have missing teeth. So we look at the whole picture and we recommend what's recommended for them. Maybe they have 3 missing teeth that they can't chew with on the left side, but they have a toothache on the right side. So when they come in, we don't just tunnel vision, focus on one area, we focus on the whole picture.
Yeah, makes sense. And right now with coronavirus, how have things changed?
You know, it's changed just a little bit. I mean, there has to be some changes because we have to be more cautious. But at Stonehaven Dental, we're we want people to feel relaxed.
Yeah.
So, you know, we call and we check on them before their day of their visit. We do screening questions, and when they come into the office, we check their temperature. They answer a questionnaire, you know, have you been out of the state, out of the country, etc. But other than that, in dentistry, we've always practiced infection control, so it's really not that much different.
You said cracked teeth have been kind of an issue during this time. What's that all about?
So there was a recent article in the New York Times, and it said that dentists nationally are noticing an epidemic of cracked teeth. So, you know, what this is about is there's a lot of stresses that people have nowadays. I mean, things have changed drastically for their jobs. Schools aren't really in a regular type of session right now. There's a lot of just unease out there in the world. And people are really clenching their teeth, and they're starting to crack their teeth more and more often. So that's what we're noticing.
Wow.
How do we avoid that?
Yeah.
Well, there's multiple ways to do that. When I see my patients, we like to try the holistic approach and just say, you know, if you're noticing that you're clenching your teeth more often, maybe meditate more often, or do some breathing exercises. You know, I have an Apple Watch that tells me to breathe like every 5 minutes.
Yeah.
So, you know, I'm like, oh yeah, I do need to breathe. I guess I'm not breathing. But, you know, we have a lot of anxiety that we hold in.
Yeah.
So we talk about, you know, a holistic approach. But then there's also like, you know, mouth guards that they can wear at night where they can cushion their teeth together. And there's also Botox therapy that can help treat muscle pain that's related to your jaw joint.
So, what'd you bring today?
Okay.
Show us a little.
What's in your box?
I brought you guys just an example of, like, let's say somebody had lost all of their teeth. And I don't know, am I holding this in the right spot?
I think that's
They've lost all their teeth, but they want to have their teeth back again. So what we can do is what's called an all-on-4 procedure, or where we do implants that replace the missing teeth, but give them a very natural and aesthetic-looking set of teeth. So to the rest of the world, they have regular teeth.
Yeah.
But to their dentist and to them, they know that they have implants that replace their old teeth because they fell apart, maybe they neglected it for a long time. And it's just a great way to bite into an apple and to eat a T-bone steak and whatever else they want to do.
What's the process like that? I mean, that's a lengthy process, yes? Or how many visits about?
You know, it has to be done accurately.
Yeah.
And so at Stonehaven Dental, we focus on accuracy and quality. So there may be several appointments in between, but it starts with the initial impressions. And then we walk them through the process, and we get the teeth out if they're still there, and then we place the implants, and then we let the implants heal and settle. But roughly after about 6 to 7 months from start to finish is when they're going to get their final strong set of teeth, to where all they have to do is come in and get a hygiene check and make sure that they're flossing and they're brushing their teeth.
And how painful is that process? Because it seems a little scary.
The only part that's really sore is the day that the implants are placed, and the gums are sore for maybe a day or 2.
Okay, it's not bad.
But a beautiful smile from then on.
You know, a beautiful smile is so priceless. I mean, I had a patient tell me yesterday, she hugged me like 3 times before she left the appointment, but she was like, you know, I got a promotion at work and I didn't apply into it until I came to meet you guys. I didn't know if I had the self-esteem to do anything like that. But when you guys started helping me with my teeth, I get my Invisalign done, I had gaps there, now they're closing, and then you did my implants. I felt really good. And so
awesome.
I want to thank you guys. She just thanked us. She said, you guys gave me the confidence I needed to smile and to say I can do this. So that's what we love to do.
That's amazing.
Awesome.
So great to hear. And we can find out more where you're located. How can we find out more about you?
So we're at thestonehavendental.com. Our office number is 254-420-4211. And everything there is
Not the
listed
right
on the
one,
screen.
but you said the right one.
Yeah.
All
Email
right.
us and we'll tell you the right one. But
What is the most common procedure that people are getting done right now?
Implants and crowns, mainly because of the cracked teeth that we were talking about earlier. So when teeth get cracked, depending on how deep the crack goes, it's a savable problem, and most of the time it would be a crown to fix that problem. And then there are gum therapies, because a lot of people haven't been in for their cleanings. Maybe it's been COVID since they've had a cleaning, and that's like, maybe 9 months ago. And so there's a buildup of tartar that they're just not getting taken care of. So gum therapy is really, really high right now because all that gum disease is spreading.
Gotcha. All right, Dr. Town, thank you so much for being here.